Imagine waking up in the dead of night. You're lying in bed, your mind is alert, but your body refuses to move. It's as if you're trapped in your own body, unable to break free. You try to speak, but no sound escapes your lips. Your voice is locked away, leaving you in a silent scream. You feel a crushing pressure on your chest, making it hard to breathe. It's as if an invisible weight is pressing down on you. This terrifying experience, my friends, is sleep paralysis. It's a phenomenon that has haunted people for centuries. Sleep paralysis is a sleep disorder that disrupts the normal transition between sleep and wakefulness. It can occur as you're falling asleep or waking up. It occurs when your mind wakes up from sleep, but your body remains in a state of paralysis. This disconnect can be disorienting and frightening. This disconnect between your mind and body can be incredibly frightening, often leading to feelings of intense fear and anxiety. The sensation of being trapped can be overwhelming. While the experience can be unsettling, it's important to remember that sleep paralysis is not life-threatening. It will pass and you will regain control of your body. It is a relatively common sleep disorder affecting millions of people worldwide. Many people experience it at least once in their lifetime. Understanding what causes sleep paralysis and how to manage it can help alleviate the fear and anxiety associated with it. Knowledge is power, and with the right information, you can face sleep paralysis with confidence. Sleep paralysis can manifest in different ways, but the core experience remains consistent. A terrifying feeling of being trapped inside your own body, unable to move or cry out for help. Imagine being fully conscious, aware of your surroundings, yet unable to move a muscle or utter a single word. It's as if your body is betraying you, leaving you in a state of helplessness. This sensation of paralysis is often accompanied by a feeling of pressure on the chest, making it difficult to breathe. The weight feels almost unbearable, as if an invisible force is pressing down on you. Adding to the terror, many individuals experience vivid hallucinations during sleep paralysis. These hallucinations can be so lifelike that they blur the line between reality and nightmare. These hallucinations can be auditory, visual, or even tactile. You might hear strange noises, see unsettling images, or feel something touching you. Some people report hearing strange noises, whispers, or footsteps approaching their bed. These sounds can be incredibly disturbing, heightening the sense of fear. Others see shadowy figures lurking in the corners of their room or even feel a presence sitting on their chest. These figures often appear menacing, adding to the overwhelming sense of dread. The hallucinations often amplify the feelings of fear and anxiety, creating a vicious cycle that can be difficult to break free from. The more you panic, the more intense the experience becomes. The experience can be so vivid and realistic that it leaves a lasting impression, often making it difficult to fall asleep again. The fear of re-experiencing sleep paralysis can linger, affecting your overall sleep quality and mental well-being. To understand sleep paralysis, we need to delve into the fascinating world of sleep cycles. Sleep is a complex and dynamic process that involves multiple stages, each with its own unique characteristics and functions. Our sleep is not a uniform state, but rather a dynamic process that cycles through different stages. These stages include light sleep, deep sleep, and the most intriguing of all, REM sleep. One of these stages is rapid eye movement, or REM sleep, the stage where most of our vivid dreams occur. During this stage, our eyes move rapidly behind closed eyelids and our brain activity increases significantly. During REM sleep, our brains are highly active, almost as if we are awake. This heightened brain activity is responsible for the vivid and often bizarre dreams we experience. To prevent us from acting out our dreams and potentially harming ourselves, our bodies enter a state of temporary paralysis known as muscle atonia. This paralysis is a natural and essential part of REM sleep. This natural paralysis prevents us from jumping out of bed or running around while dreaming. It ensures that our physical bodies remain still, even as our minds are active and engaged in dream scenarios. Sleep paralysis occurs when this muscle atonia persists even after our brains have partially woken up from REM sleep. This can be a disconcerting and frightening experience. Essentially, our minds become conscious while our bodies remain stuck in this dream-induced paralysis. This state can last for a few seconds to a few minutes, during which the person is fully aware but unable to move or speak. This mismatch between mind and body leads to the terrifying sensations of sleep paralysis. Many people report feeling a presence in the room or seeing shadowy figures, adding to the fear and confusion of the experience. While the exact causes of sleep paralysis are not fully understood, research suggests that several factors can contribute to its occurrence. One of the most common triggers is sleep deprivation. When we are sleep deprived, our sleep cycles are disrupted, increasing the likelihood of experiencing sleep paralysis. Irregular sleep schedules, such as those caused by shift work or jet lag, can also trigger sleep paralysis. Stress, anxiety, and certain mental health conditions, such as bipolar disorder and post-traumatic stress disorder, or PTSD, have also been linked to an increased risk of sleep paralysis. In some cases, sleep paralysis can be a symptom of other underlying sleep disorders, such as narcolepsy, a chronic sleep disorder characterized by excessive daytime sleepiness and sudden sleep attacks. Understanding these potential causes and triggers can be helpful in managing and preventing sleep paralysis. So, who exactly experiences sleep paralysis? Well, it's actually more common than you might think. Studies suggest that around 8% of the general population will experience sleep paralysis at some point in their lives. Interestingly, it affects both men and women equally. It can happen to anyone, regardless of age. However, it's most frequently reported in teenagers and young adults. Certain factors can increase the likelihood of experiencing sleep paralysis. These include sleep deprivation, irregular sleep schedules, and high levels of stress. Some people with mental health conditions, such as anxiety or depression, might also be more prone to it. It's important to note that sleep paralysis can occur in people who have narcolepsy, but it can also happen to those without any underlying sleep disorders. So yeah, it's pretty widespread and not limited to any specific group. Narcolepsy is a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of sleep. It can have a significant impact on mental health, often leading to anxiety and depression. People with narcolepsy may also experience cataplexy, a sudden loss of muscle tone triggered by strong emotions. It's important to understand that narcolepsy is more than just feeling tired. It's a serious condition that requires medical attention. While there is no cure for narcolepsy, various treatments can help manage the symptoms. Medications such as stimulants can help reduce daytime sleepiness. Antidepressants are often prescribed to control cataplexy. In addition to medication, lifestyle changes can make a big difference. Maintaining a regular sleep schedule, taking short naps, and avoiding caffeine and alcohol can help improve sleep quality. Cognitive behavioral therapy is another effective strategy to cope with the emotional challenges of narcolepsy. Narcolepsy has been recognized for centuries, though it was often misunderstood. In ancient times, people with narcolepsy were sometimes thought to be possessed or cursed. In the early 20th century, medical research began to shed light on the true nature of the disorder. Today, narcolepsy is better understood, but there is still much to learn. Cultural representations of narcolepsy in literature and media have also evolved, from depicting it as a comedic quirk to recognizing it as a serious medical condition. In conclusion, narcolepsy is a complex and often misunderstood condition that affects many aspects of a person's life. With proper diagnosis, treatment, and support, individuals with narcolepsy can lead fulfilling lives. Raising awareness and understanding of this condition is crucial in helping those affected. Thank you for joining us in exploring the world of narcolepsy. Together, we can make a difference.